Thank you very much for the invitation and for the chance to share with you the relation between alcohol and cancer. I am Alba Gil, and I am Policy Officer for Cancer Prevention at the Association of European Cancer Leagues. At ECL, we give voice to regional and national cancer leagues that cover the full spectrum of cancer, from prevention and early detection to palliative care. We basically work for a Europe free of cancer. Alcohol, together with tobacco, ultra-processed food, and fossil fuels, has been established as one of the four industries that cause 2.7 million of deaths in the European Union per year. This is more or less 35% of all deaths that could have been preventable. When we zoom into alcohol, we see first of all that at Europe we are heavy drinkers. We have an average consumption of 9.2 liters of pure alcohol. And this is accountable more or less for 800,000 deaths annually, mostly for non-communicable diseases that could have been prevented, such as cardiovascular diseases and cancer. When we look into cancer, we see that there is no such a thing as a safe amount of alcohol for cancer prevention. And we know that alcohol causes 7 kinds of cancer. And it's one of the main risk factors for the most common cancer among men, which is bowel cancer, and also for women, which is breast cancer. And the fact that alcohol is one of the risk factors for breast cancer is not known among women. If you ask around, no one knows this. And one of the myths that we find here very commonly is that people believe that you have to be a heavy drinker to increase your risk of cancer related to alcohol, but this is just not true. The International Agency for Research on Cancer from the World Health Organization has established alcohol as group 1 of elements that cause cancer. This is the same group as tobacco, this is the same group as asbestos and as radiation. There is no safe level of alcohol consumption when it comes to cancer prevention. Uh, Even 0.5% of all the cancer related to alcohol are caused by light and drinking in moderation. So you don't need to be a heavy drinker to suffer the risk. So the message that public administration should be putting out is basically that the less, the better, and none is best. There is no such a thing as safe amount of alcohol, or there is no such a thing as harm use of alcohol, because that implies that there is a safe use of alcohol, which is just not true. Uh, for public health advocates, it's not the first time we are fighting a highly addictive product. It is easily accessible, widely available, cheap, socially normalized, and even socially encouraged, with devastating health outcomes and deep penetration in the political power structures. Indeed, we did it again. We did it once, and we can do it again. If we look back at tobacco history 30, 40 years ago, we see that it was absolutely normalized. It was encouraged everywhere, in planes, in hospitals. Your doctors were recommended that, and it was even targeted to kids with these chocolate cigarettes. And if we look at the pattern, alcohol nowadays is exactly the same. Alcohol is the only drug that you need an excuse not to consume nowadays. And it's possible everywhere. It's possible in planes. It's possible in hospitals. We still hear some doctor recommending it, and it's targeted to kids with the child versions of champagne, for example, or the non-alcoholic beers that are mostly targeted to minors. In order to denormalize cancer, we need to denormalize alcohol. How can we do that? The World Health Organization has set some lights and has established the best buys for tackling non-communicable diseases. And the conclusion is obvious. We need high taxes. We need to make it expensive. We need restricted advertising, which is we need to make it invisible. And we need to limit the availability. It cannot be everywhere. So the conclusion is make it expensive and make it invisible. And also raise awareness about the risk. The European Code Against Cancer, which is also released by the World Health Organization, has established the 12 ways to reduce cancer risk at individual level. And of course, one of them is don't drink alcohol. And at the end of the year, we will have the new code with a very similar messaging. And we see some initiatives that are already working quite well. For example, in Ireland, from 2026, it will not all alcoholic drinks will have the health warning, making people aware of the harmful consequences of drinking alcohol for the health, just as it stopped with tobacco. And we also have the alcohol monopolies in the Nordic countries that limit the constant availability that we have nowadays in the rest of the countries. These are specific shops where with very limited timetables and availability, so that buying alcohol is not easy. So mainly the takeaways, first of all, change is possible. We denormalized tobacco and we have to denormalize alcohol in order to denormalize cancer. We have to be careful. We cannot fall into the same mistake that we did with tobacco. Nowadays, tobacco is heavily inclined depending on the socioeconomic level of the population. We know that low income populations are the ones smoking, and we know that they are the ones suffering more from the smoking consequences, such as lung cancer, which is one of the most lethal cancers. And of course, low-income populations have less access to healthcare systems, to access to medicines, to social benefits and social structures when it comes to facing cancer. And these mistakes need to be avoided. We cannot create a set of policies that are marginalizing low-income populations, so they are the one drinking. We need to implement the European Cancer Plan. This is the most ambitious plan that has been ever put forward at the European level to tackle cancer. And although many of the initiatives have been put in place, we see that when it comes to prevention, for example, alcohol labeling has not been implementing measures to enhance and to promote healthier diets have not been implemented, and we can do way better at European level. We have done it already with tobacco, and we can done it again. It is a matter of political will. We need to put forward policies that protect citizens. We need to make it expensive, and we need to make it invisible. We need to stop with the constant availability and the constant exposure to alcohol. We need to tackle the normalization of alcohol. We need to raise awareness. Population are not aware that alcohol causes cancer. Yeah, they are aware that it's not a good idea, definitely if you are pregnant, but not that is one of the main risk factors for several cancers, and that directly cause 7 kind of cancers, including breast cancer. For that, we need to promote further the European Code Against Cancer. We need to put in place public campaigns, and we need to put in place the health warning labels. The European Commission must act. The European Commission is the guardian of the treaties, and according to the treaties, they must ensure a high level of health protection in all policies. And this includes protecting Europeans from cancer. And member states can push for change. We are already seeing it. We can see it with Ireland. We can see it with the Nordic countries. The member states are pushing because the Commission is not doing their homework. And this is just a fail from the Commission to protect European citizens and to guard the treaties. And for the general public, again, the less, the better, and known is best. There is no safe amount of alcohol when it comes to cancer prevention. Thank you very much. And please don't hesitate to drop me an email if I can do anything for you. Thank you.